Digital Health Institute for Transformation welcomes you to the D-Hit Frequency Podcast.
Welcome, D-Hit community. You're here with Michael Levy with the D-Hit Frequency. I'm here with Dean Todd Telemeco from UNC Pembroke College of Health Sciences. Todd, first part of our segment on D-Hit Frequency is getting real. It's about understanding who you are, what drives you. When you wake up in the morning, you open your eyes, you look at the clock. Generally, you're given a choice. You hit that snooze button, or you pop out of bed. What happens?
Man, I pop out of bed because I have one goal, and that's to serve as many people as I can in a single day. And so I think about that every day. You know, it's funny because everybody asks me all the time, how did you get into academics? You were a physical therapist, you were in clinic, you became a faculty member. And I said, yeah, but if you look at my life and every step I've taken, the first step was I treated 20 patients a day. And so I changed 20 lives a day. And then I went to academics, and all of a sudden I had a class of 40 who, if I multiply that out for every year that I taught them, now I'm reaching hundreds to thousands of patients a day through my students. And now as dean, I go beyond my own profession. So before I was physical therapy, now I'm doing nursing, I'm doing physical therapy, occupational therapy, physician assistant. All those different professions I work with are now treating those folks. And now my ability to reach those folks has been multiplied exponentially. And so I get up every day thinking about what's the next step to make that even more. Because as I said, my goal is to reach as many people as I can.
That'll inspire anyone to get up, knowing that the energy that you put forth every day is directed to the betterness and improvement of the world you live in every day. And that circle of value, enriches us. And I feel that the community at D-Hit feels it because we're made up of those that orient around purpose, orient around mission, and understand that, how you spend your time and what you spend your time on every day actually matter. You just recently become Dean Todd Telemeco at UNC Pembroke of a newly really kind of appointed College of Health Sciences. You've had an experience that you just summed up in all these activities that you do throughout the day and you spend your time on historically, but now summing up all of that, now waking up with that summed mission and purpose, and now you're a newly appointed dean, what are you going to put your energy towards?
Well, I think initially it's new programming, right? So I'm the founding dean of the College of Health Sciences, and what that really means is we have 4 departments. And so right now, I'm trying to develop programs that can reach a larger audience, right? So more programs. What do we need? For my community in Pembroke, we need frontline practitioners. So our focus right now is expanding our nursing program. It's adding a physician assistant program at some point. It's adding occupational therapy. Those folks who are going to be the practitioners. Behind the scenes, though, I'm also looking at other programs that look at infrastructure. And I think that's what intrigues me about the D-Hit, is that maybe that infrastructure isn't quite there yet, or it's there, but maybe arcane. And maybe there's a new way of looking at that architecture. So what I'm excited about is, because I'm a new college, I'm in a position to begin to think outside the box. And I don't have to do it the same way I've always done it when I was the dean at other institutions or a program director. I have the opportunity to really shape the next generation and really change the way we look at healthcare in a unique way.
I mean, what an opportunity. And in our moment of time in history, I share this quite a bit because it really anchors us in the moment of time. It's 1919 in the 21st century from our point of view. Knowing that and being aware to how, I would say, immature our infrastructure, the new architecture, let's say, of the 21st century is, and given this opportunity, what's that vision look like? I mean, let's fast forward, 5, 10 years. You're sitting there and you have circular of influence that you've built over this life of yours. You have the future potential circular of influence, and you have an opportunity to share that vision. What's your imagine if, Todd?
Imagine if I had all the access to the information I need to make the best decision for my patient, and I could do that very quickly. right? We live in a world where we want instantaneous, we need information to do that. Imagine if I had access to all the things that impact that patient. So I made that decision, how to treat that, how to direct their care. I could take all that in and make the best decision possible. A lot of time as a clinician, when I was in full-time practice, I would make decisions, and I thought they were informed decisions. Don't get me wrong. I spent time with my patients, my clients, asking the right questions. But often, the second and third visit, we were redirecting that. And so now I've lost 2 or 3 visits with those folks because I went down a path that I thought was correct, but I had to redirect when I learned a new piece of information. And if I had that one piece of information up front, I could have saved them resources. I could have done a better plan of care. I could have pushed them in a better positive direction and really gotten a better outcome in a faster way. So for me, information, we've had this conversation before, information to me is the driver of healthcare. I tell my students still today that if you sit and talk long enough, the patient will tell you what's wrong with them, and they will get better. One, because they talk to you and they got something off their chest, and you actually listen to them, but you can actually guide them with all your expertise in the right direction. And so imagine if I had access to that information ahead of time, so that time that we had together with that patient, that 20 minutes could be that much more fruitful. I can imagine a time where I can see the number of patients I need to see, so I can help as many people as I can, but with better information up front. That's what I get excited about, that I can make that decision.
It's amazing. With obviously technology as it stands today and the rate of advancements in technology, reaching Moore's law, right? The possibilities of delivering that information is there. The possibilities of acting on that information is there. The possibilities of connecting that person who you're caring for and caring with to a whole ecosystem of new services and solutions. It's there. In your in your future, what's the world look like around the patient or the consumer or the individual or the community as it relates to where care and how care is being delivered?
Let's talk about the where care can happen. I think, right now we do a lot of care in facilities, name it, hospital, outpatient practice, physician's office, wherever that would be. And that's a barrier for some folks, right? I mean, just getting there. Imagine if we had the ability to talk with the patients through the internet, right? WebEx them, whatever. You can meet with those folks. If I had the information up front, do I need to see them face to face every single time? Probably not. But what if I could send a community member out? That could be my hands, right? And so with the right information, I could send the right person out and have them do a couple things for me, give me some more information, and treat that patient in their home. So now I've taken a barrier away. You can't get to me, I'm gonna get to you. And obviously we don't have teleportation yet, so I can't teleport myself to their house. But it could happen. But if we train, maybe it's the architect, maybe it's that health architect that can go out and do a couple of things for me and gather some more information that I can't get directly from the patient and add to that picture, say, that's what I want, that's what I need, here's what needs to happen. But I made those decisions based on the information I received ahead of time, right? Yeah. And so I think this idea that I'll have access, I can call up a patient, whether it's a card in their hand, a thumb drive, a login somewhere that I have access to, but I can pull that information up, and through, whether it's artificial intelligence, algorithms that we build, that the relevant information, and I mean a dearth of information, comes in and distills down the key components for me. And I'm less likely to forget the question to ask, right? Because I found myself as a clinician often that if I would have asked one more question, if I just would have stopped and asked that one question, it would have changed everything. And either I didn't because there wasn't time, which seems to be a constraint these days, or I just didn't pick up on the cue, and I needed that little bit of help to pick up on that cue. Imagine the care I could give. And
I love that you anchored on that, because we often talk about where AI and what AI should support us in, and where should it start, where should it stop. And I think you're hitting on a really important anchor point that supports the idea that AI can help us in the discovery and the definition of our data, but let our humans design and deliver. And that is, I think, a really kind of beautiful harmony and juxtaposition between leveraging the capabilities and the assets of one versus the other. You cannot ask a human brain to evaluate the petabytes of data that a human being creates every single day and extract signals of insight that might be or might not be relevant to you as a care provider. But what you can do as a care provider is say yes or no very quickly of what is relevant, right? You as a provider, when you find relevant information in that, in this vast of data, you then know what to do with it.
We have a lot of evidence in medicine as a whole. If you're a researcher, the way you get published is you create this very artificial environment where we're studying one thing and we try to remove all those other factors so we can show a change, right? But it's very artificial. What this does, you can take that data and put it in, but now we begin to see the interplay between all that different data on a real life situation. So where you might say this treatment is effective for this group of folks, well, maybe giving these conditions, but what happens if I add in this piece of data? And now, do I get the same result? And if I do, I begin to build a wealth and say, you know what? Now AI can learn from that, okay, it's not just this piece of data, it's this and this together, which make it more powerful, and present that to me up front, and so that makes it more helpful.
So that interrelationship between artificial intelligent, learning system that supplies, the critical information at the time of need to service the relationship between the human being and the human being, or the patient and the doctor, or the caregiver and the consumer, whatever you want to define.
And maybe we will call it a consumer at some point, right? And not a patient. I struggle with it. Are they a client? Well, they're, I'm not a lawyer, so I don't think they're a client. Are they a patient? That implies illness. I'm in the business of treating the whole person. Yeah. And so I hope that language changes too. Yeah. I don't know what it is, but consumer is a better term because I think we're offering services that they are consuming.
I would agree with you 100%. I feel more comfortable saying consumer. When I say patient, I think that we're pulling wool over our eyes and trying to suggest that we aren't ourselves patients. And that seems somewhat oxymoronic, if you will.
Well, the idea of a patient is someone in a bed, right? When I say that word instantaneously, I see someone in a bed somewhere. But when you talk about healthcare transformation doesn't occur by treating the diseases, right? It's really about all the other things that influence us. It's that wellness piece. If I have enough information, I can prevent some more serious things happening down the line. And I think that's what's important is that we got to get away from we're going to treat sick people. I mean, we certainly need to, when they do get sick, treat them, but we need to get away from that model, that traditional medicine model, and look at this public health model of what are the influences, where can we make change, how do we impact those? Because if we impact that, then we're going to have less likely to have these really sick people, which are extremely expensive, right? You can't stop a car accident all the time, and we're going to have to deal with that. But we can slow down diabetes. We can slow down glaucoma. We can musculoskeletal problems. We can slow those down through education. So there are ways to take those expensive patients, and I hate that term again, those group of folks who are struggling with some event, pathology, problem, and we can fix it up front. Or address it up front, maybe not fix it, but address it up front.
That's the imagine if. When it all's said and done, I think the ability to leverage all of our resources that we have to move our care upstream in a preventative, proactive manner, allowing, I think, a market to free itself of all the answers and allow the answers to be driven by the individual who allows you to know who they are.
I remember a faculty member one time, Todd just said, what do you hope for? I said, I hope that someday I work myself out of a job. In that I've done I've changed so many things that my traditional services are no longer needed, right? You don't need me to do range of motion anymore because it's not a problem. That's right. And so I would love to have that happen. That would be a fantastic imagine if my services were never needed.
And on that note, Todd, thank you very much. We, as a community at D-HIT, are privileged and thankful for your support, your championship in your communities, as well as the connective tissue that allows us to collaborate together. We take every opportunity to appreciate those who are supporting a new way, a new system. We are the game changers, the status quo challengers, and the transformers that will build the future together. Rock and roll, Todd. Appreciate you.
Looking forward to the ride.